Thank you, Dr. Saad. Now I'll hand it over to Karen Riddell, our CNE and Chief Operating Officer. What Karen's going to highlight is one of the ways we are preparing or have been preparing, technically going back for years, and definitely over the last handful of months, getting ready for what's facing us now, let alone what's coming in the fall and the winter, and trying to offset what some other systems have experienced currently is what is called HHR, Health Human Resources Challenges. So I'll pass it over to Karen.
Great, thank you, David, and good evening, everyone. So just a very brief update on our health and human resource work that we've been continuing throughout the summer, and we've discussed this in the last board year as well. Since prior to the start of COVID, we actually have employed 10% more frontline staff than we had prior to the start of COVID. So we've been very aggressively trying everything within our power to bolster our resources. So some of these initiatives we actually started prior to any provincial programs being available. For example, hiring third and fourth year nursing students. So we've hired close to 500 nursing students since the beginning of the pandemic. We currently have 174 on staff, and we're looking to onboard. We just onboarded another 50, and our target is to have 300 third and fourth year nursing students onboarded over the next 2 weeks. These students have really been critical to helping us sustain our operations throughout the pandemic. And also a great benefit to our future recruitment. So many of those nursing students also stay on after graduation and become our new registered nurses and registered practical nurses. We've also, earlier this year, we applied for and were approved as a supervised practice experience program partner. This is a program that's offered through the College of Nurses of Ontario in collaboration with Ontario Health. So we get matched with IEN, or internationally educated nurses, through the provincial system. And we've been able to initiate training with 12 of those internationally educated nurses so far. We've proceeded to hire 3 of them that have successfully completed the program and attained their registration with the College of Nurses of Ontario. And we have 41 others that we're working with and hoping to onboard soon into the program. So this is a great opportunity. There are approximately, I believe, 26,000 internationally educated nurses in Ontario that are just needing to get their registration. So this is probably one of the fastest ways that we can bolster our human resources in Ontario with the nursing shortage. We've also been what we call collapsing part-time clinical jobs into full-time jobs as much as possible. So if we have part-time positions that are unfilled and people are looking only for full-time work, we combine 2 part-time jobs into a full-time job. And this has helped us create an additional 12 full-time jobs that we've been able to fill. And then we also have temporary positions that are posted when someone is off on a sick leave or a maternity leave or perhaps an education leave. And normally we post those as temporary positions, so they're a contract term. They're not particularly attractive for external hires. So we have been converting those into permanent positions, and we'll be balancing those, of course, through attrition, so that we are able to create those permanent positions, including both part-time and full-time positions, to attract new recruits and to also help retain our staff so they don't have to leave the hospital to attain a full-time position elsewhere. So these strategies have been really successful. We're still working very hard and working with our human resource department, and our new VP, Todd Bested, and his team are doing great work with our recruitment and job fairs and our advertising. So it's certainly, we still have some work to do, but we're in a pretty good shape going into the fall and winter and looking at the numbers of beds that we're going to have to operationalize. So that's all for me.